All right, thank you very much, Dr. Demanis, for the introduction. Thank you to Mayo School of Professional Development for inviting me, and the course directors for a fantastic course so far. Hopefully we finish up strong. I'm going to talk today about emerging regenerative therapies. Titled the talk, Hope or Hype, What the Evidence Shows, and we can skip right to the punchline. It's a little bit of both, a little bit of hope and a little bit of hype, and hopefully over the next half hour or so I'll help you navigate through the difference between the hope or hype, and we'll take you on a whirlwind tour of what's out there so far. Apologize, my disclosure slide got dropped, but I have no relevant financial disclosures for this talk. I'd like to start off with this painting, which depicts a scene not too far from here, from over 450 years ago in St. Augustine, or as was termed back then, La Florida. And of course, what this is Ponce de Leon finding the Fountain of Youth 450 years ago. And of course, here we are, several hundred years later, and this is what we're still all in search of, right? The fountain of youth for our patients, for our athletes, for ourselves. And of course, the reason is we have unmet patient needs. In my particular field, we're talking about joint and tendon disorders, but you could name any medical specialty that you take care of, and there are unmet patient needs. For an example, degenerative joint disease, we have an aging population, an active aging population. These individuals want to remain active and remain in their sports. Many are baby boomers and have come of age in a very high demand fashion. Of course, we have an obesity epidemic as well. And what this has led to is approximately 400,000 knee joint replacement procedures done each year. And then you add to that hip replacement and shoulder replacement and other arthroplasties, and you really have a staggering number of surgical procedures being done every year to treat this problem. The cost to our healthcare industry is $7 billion a year just for those joints alone. And why is that? Well, we don't have very good non-surgical treatment options. This is from 2013. It's the American Academy of Orthopedic Surgeons and their position stand on what the non-surgical recommendations are for the treatment of osteoarthritis. And really, it comes down to the top three, which are not even strongly recommended: physical therapy, gentle over-the-counter pain relievers, and the occasional steroid injection. All these things on the bottom.